Hello, my name is Stacy Holcomb, and this is my Nurse 868 Curriculum Plan Nursing Education Major Course Proposal Presentation, Part 4 of the Major Course Project, LVN to ADN Transition, the Need for Clinical Hours, and Concept Map Implementation. So my project focused on Rio Hondo College, a community college located in Whittier, California, and they currently offer a licensed vocational nurse LVN associate degree in nursing transition course entitled ADN 075. And this course is for students seeking entrance to the second year of the associate's degree in nursing ADN program. Enrollment is based on how many seats are available during that second year of the ADN program, and enrollment usually averages about 10 to 15 students. Since the inception of this course, Rio Hondo College has found students who complete ADN 075 and enter into the ADN program really have a high attrition rate. And I'll get into that a little further along in the presentation here. A literature review reveals, however, that Rio Hondo College is not unique to this issue. And discussion with key faculty has raised the possibility of adding a clinical component to the current ADN 075 curriculum. I've also, for my presentation and proposal, have added a concept map component as well. This needs assessment is the beginning of further discussion and possible implementation. The ADN 075 course is an 8-week course, 36 hours of theory and 28 hours of skills. And speaking with students, and I agree with them, I really feel this could be a 16-week course solely based on how much theory is put into the instruction of it. But for now, we determined to leave it as an 8-week course and add a clinical component possibly, and then move on from there to determine whether the course will be extended out to 16 weeks. It's expected once the students complete ADN 75 that they are prepared and are at the same skill and knowledge level as their second year ADN peers. Historically, the bridge program has had a higher attrition rate, with many either failing out of the bridge program entirely or having to re-enter the bridge program after failing out of a course. From the year 2017 to 2020, a total of 76 students have been accepted into the bridge program after passing ADN 075. However, the overall pass rate of the bridge program is 58%. So an attrition rate of 58% is actually fairly high. In doing research, it's not an unusual occurrence for these LVN students transitioning into ADN programs not to succeed, and I'll get into that a little bit. But 58% is pretty much average for this type of student, unfortunately. With the graph that you see here, you can see the light blue is failed, the dark blue is passed. 2017, more students failed than passed. 2018, almost the same. In 2019, I'm not sure if that is a numbers problem or some type of change in the curriculum. I don't see a change in the curriculum. However, there was an instructor change at this year. However, the same instructor was teaching the class through 2020, and you can see in 2020, again, more students failed than passed. Overall, we're at about 60% passing, 58% not passing the courses. Speaking with the faculty as well as students that have completed the ADN Bridge program, it's been determined that these students are just not accustomed to the rigor of the ADN program once they get in. In fact, speaking with these students, they'll actually come out and say that they just don't know what hit them. It's just so time consuming for them. Hune et al., as well as some other literature studies that I reviewed, I came up with 4 different concepts or barriers that these students seem to face as they pursue their academic progression. Some of these barriers include difficulty in accepting fresh perceptions and alternative ways of thinking, as well as not being accustomed to self-directed learning. They also have the need to continue working while attending classes. These students are often a little older than your basic ADN student. They may be supporting families already. They are already working and have bills and need to continue working as they go through the program. Not only that, they feel shock and anxiety and stress due to the result of misperceiving the rigors of the program. And lastly, they are unfamiliar with acute care settings. These students, a lot of them, are working in SNFs. And once they get into the acute care setting, they have a difficult time breaking away from their task-oriented way that they work and bridging over into a more clinical uh, nurse processing way of thinking. Here we have what's currently offered in the curriculum and what the revision proposal is. So the current curriculum, they have 36 hours of lecture, uh, could be more, as I mentioned before, as far as the hours provided for lecture. 28 hours of lab skills and no concept maps. My revision proposal would still be 36 hours of lecture. However, I really feel that the 28 hours of lab skills could be cut down quite a bit. These are students that are already LVNs. Granted, some of them have different background, different jobs that they work as. Some of them have not had a chance to perform these skills that they've learned, possibly learned quite a few years ago. But I really feel that 8 hours of lab is plenty to bring them back up to par as far as Foley insertion, NG tubes, IV skills, things like that. I think those additional 20 hours could be used towards acute care clinical hours. And then, of course, we need to add a concept map as well. Providing acute care clinical hours would hopefully serve three purposes. It would provide experience in academic rigor, it would provide exposure to acute care, and also would develop clinical thinking skills for these students. The ADN students, the peers of these LVN Bridge program students, once they enter year 2 of their educational career, already have had 2 semesters of clinical rotations at various facilities. They've had the opportunity to experience and practice the nursing process of diagnosis, assessment, and intervention, along with other aspects of the registered nurse scope of care, such as delegation and collaboration in acute care settings. The LVNs who bridge into the second year with these ADN students have not had that opportunity, yet they're expected to perform at the same level as their ADN peers. I think it must be remembered that these LVNs, unlike RNs, are trained for more task-oriented patient care, such as medication administration, glucose checks, and the like, to primarily non-acute patient populations. Some of these LVN transition students find acute care to be really overwhelming. Porter Wensloff stated that LVNs transitioning to the RN role really need clinical experience to move them out of their comfort zone and build clinical reasoning skills. And of course, we can't have clinical hours without the concept map, right? We know that concept maps develop critical thinking skills. It also brings together clinical experiences to existing knowledge. In essence, it helps the student put the puzzle pieces together. Patient has CHF. They're getting furosemide to help get rid of the fluids. All of that, once it's on paper and they start putting the pieces together, it starts to make sense to them. So there really has to be a concept map included in this curriculum, I believe. In conducting a literature review for adding clinical hours, 3 things came to light. Transitioning LVNs need clinical experience to move them out of their comfort zone. Clinical hours creates an atmosphere to develop critical thinking and leadership, and clinical hours also move students away from their task-oriented behavior that they're so familiar with. And the literature review regarding concept maps, it was found concept maps develop prioritization skills and also uses the nursing process and helps build that skill, which of course is vital to developing clinical judgment. As we know, the educational philosophy as well as the models in which we build our curriculum on really drives how well our curriculum does, I think. The current model for Rio Hondo College, all of their nursing program is based on the systems developmental stress model. In doing a research on this model, I came up with 3 hits. This model is actually very outdated. It was developed in 1974. And my inquiries with several lead faculty, no one was able to determine what the systems development stress model actually is or where it originated from. In speaking with my preceptor about this, she stated that the need to change this model has come up every 5 years whenever the BRN came around for approval. However, changing the model would have required a major curriculum change. So she said that this has been ongoing since at least 1999 when she began teaching at Rio Hondo College. She thinks that perhaps this model has been used since the inception of the program in 1981. It's really outdated and just not driving the curriculum at all. It's just there as a placeholder, I think. My recommendation would be to replace the model with a more current relevant model to better guide evidence-based curriculum development. Um, I think right now really current is the conceptual learning model, and that requires students to kind of live by facts and concepts through active process, such as completing case studies, questions, or problem solving activities. This really encourages students to practice thinking. And again, this would help students move away from task thinking to clinical thinking, I believe. As you can see on this slide, course outcomes are there for number one would be apply critical thinking at the bedside. Number two, interpret findings. Three, determine quality and safety measures in care. And four, identify desired outcomes and evaluations. To evaluate the outcomes of this course, student post-course surveys would be conducted, a contrast and comparison of second-year ADM peer grades, as well as ADM Bridge pass rates. As this project is in its very beginning stages, this is just a very rough Gantt chart with a rollout date, hopefully, of April 3rd of 2023. In conclusion, literature reveals there is a concern when it comes to providing seamless academic progression for LVNs. LVNs are not transitioning through ADM programs as successfully as their generic ADM peers. I hope this presentation shines a light on the gap which exists between curriculum and outcome. The addition of acute care clinical hours to transition courses may fill that gap and provide the pathway of success to the LVN seeking academic advancement.